Well, some of the projects that get done, the course is basically people come and do a 3 or 4 day course, they come back for a second course, and during that time they have to do a project. And those projects are what's changing behaviour. So we've got quite a few examples. One of them is an audit that was done at Imperial College, where they actually improved the monitoring of people on a particular therapy. And by doing that, they made the therapy much, much safer, and almost certainly would potentially save lives by not exposing these patients to excessive risk. Now, that particular program has been adopted by other centres, and hopefully by spreading across the NHS, we will reduce deaths due to a complication of therapy.
So the objectives of the coming year are, we've now got a programme of 3 different masterclasses running for this year, a foundation, intermediate and an MSologist course that will look at the different varying levels of clinicians, nurses and allied health professionals to educate them to the level of that is required. But we've also got another meeting in July that addresses the variation. That's going to be a huge project, and looking at different work streams of like audit and data, patient activation, healthy lifestyle and living. So we're actually looking back and making sure that clinicians, when they come on the course, they make sure they go back and adopt a change within the service, and they then can showcase that via their projects that they do via the academy. So we've got a 16-year track record in this already, which is in Parkinson's disease. So we've rolled that out, and then the MS Academy was born 2.5 years ago, and already we're making huge changes within service optimisation.
I mean, what makes us quite unique is that we're an umbrella organisation. It doesn't matter what affiliation you have, you can belong to the MS Academy. And it's almost becoming like a professional association of healthcare professionals working in MS. So you don't have to belong to your own, very exclusive organisation. So we're building a very broad base: nurses, physiotherapists, neurologists, pharmacists,
specialist nurses.
So
everybody's included.
We're all coming together to solve this problem, and hopefully some of the tools that come out of this will be adopted across the NHS, and we'll spread good practice. That's our aim.
It's also gone international as well, so we've had delegates that have come over from Egypt, Dubai, Germany, and we've got other international programmes that we're looking at as well. So it's not just in the UK that we're trying to change, we're looking at a worldwide programme as well.